Hello and welcome. In this blog, you will learn how you can easily integrate curodont repair treatment in your workflow and in your daily practice, or even in the practice of your hygienist. The WHO Global Burden of Disease study reveals that among the top 10 diseases are 3 in our fields as dentists. So caries is still the most prevalent disease worldwide. And we see also number 10, it's caries in deciduous teeth. So there seem to be still a lot of work to do. As a repetition from block 1, you can see all the indications for regeneration with curodont repair on that slide. I have used it, as I said before, roughly in 95% of the cases for interproximal caries, and my second most indication has been occlusal caries, and I rarely use it for buccal caries or also on deciduous teeth. Here it's also mainly interproximal. The curodont repair and the curodont-repair-fluoride-plus are the same products. For the curodont-repair-fluoride-plus has been enhanced for the US market and has fluoride added. We should also talk about the limitations for that regenerative therapy. One of the limitations is caries in the cement, the root of the tooth. Here we miss the pseudo-intact surface from the enamel, which is required for these intelligent matrix proteins to start folding a scaffold or start forming the matrix. We need the enamel as a scaffold to create the matrix, and this is not existing on the cement of the tooth root. Also in arrested caries, like a brown spot, has a compact enamel surface where the peptide cannot reach deep into the porous structure below. So a generation there can also not be expected. Very important is also to look at the molar incisor hypomineralization. It is a qualitative mineralization defect. And here the product does not work. It cannot rebuild enamel which has never been matured to the right stage. As I said already during the session of the science and the clinical studies, the white spots in the aesthetic zone after debonding of brackets are a possible indication. Here the caries can be arrested and the tooth can be remineralized, but the white spot look still remains a bit. It looks less intense, the white spot. It looks a little bit more patchy and less white, but there are still some spots which remain white. So if aesthetics are a concern, one should consider doing another therapy, like a filling therapy or bleaching, for example. So what are the benefits for your practice and for your patients? The treatment with curodont repair stops the caries progression and it remineralizes and regenerates the lost tooth structure and depth. So what is in for the patient? He keeps longer his own natural tooth substance. He also increases his oral health, and it has a positive effect on overall health and well-being, and maybe even motivate him to have a better biofilm control and brush better. For your practice, it is an extra revenue stream, which can also be delegated to the hygienist, depending on the setup of your country. This prescription of the regenerative treatment for the hygienist should always be under supervision of the dentist. It also increases the reputation, and I think it's also a unique selling point because not everybody is offering that specific treatment. It's very attractive also for children because it avoids drilling a hole in the tooth. I quickly would like to cover the frequently asked questions. We saw the video in block number 1 of the application of the curodont repair, and in the video you saw that no rubber dam is used. Instead, an obturate is used, or a cheek retractor, and some cotton rolls to keep the area of the tooth which we want to treat semi-dry. You also saw in that video that we need sodium hypochlorite to remove the organic pellicle of the tooth surface. And the sodium hypochlorite should not have the same concentration as the one you use for root canal treatment. It should only be around 1% or 2%. And in this concentration is no problem, even if it drops on the gum. The taste tastes a little bit like swimming pool, but it has no negative impact on the gingiva or on the tooth. In some countries, there are also mouthwashes existing which contain a low concentration in sodium hypochlorite. That could be an alternative if the 1% is of any concern to you. So how and when should we do a checkup and see if the treatment has been successful? That makes sense earliest after 3 to 4 months. But usually the result is visible after 6 months. And we could also measure, if we look at the studies, as a further increase of remineralization from month 6 to month 9. So any time between 6 to 9 months is a good period. It depends a bit on the carious activity of your patients. If you want to get him back a bit earlier to check on his oral hygiene and nutrition, this is also fine. But remineralization can be expected to be visible after 6 months. And then you can measure that by any device you might have to detect caries in your clinic. You can inspect it by eye. If an X-ray is required, it depends on your indication. There should be really a strict limitation to take in an X-ray just to check if the remineralization has happened. So this is up to you and your routine to consider taking an X-ray or not. How do I convince the patient? Well, I always explain all the options he has. I give an oral hygiene instruction. I talk about success rates of the several treatments. But usually this conversation is very short because the patient is very happy that he can get such a treatment offered, and he avoids getting a decay or filling later on. And how many lesions can I treat with one applicator? This is one lesion per applicator. Of course, if you treat a tooth on the mesial or distal part, you automatically treat the adjacent tooth as well. So for interproximal caries, let's say the first molar has a defect distal and the second molar mesial, you treat both with the same applicator at the same time. So in that case, it's 2 basically. Does it also work on deciduous teeth? Yes, it does. But please consider that the dimension of enamel is much thinner compared to permanent teeth. So the progression of caries is faster. The caries progresses much quicker from the enamel into the dentine. And that should be considered when you do that treatment, that you maybe do a really strict case selection and only pick children with enamel defect, which has not yet progressed into the dentine. So now you see the questions I forgot to skip. Let's go to the next one. What's the difference to all those products? The fluoride, we mentioned that before, mineralizes only the superficial part of the enamel with a maximum depth of 25 micrometer, whereas the curodont repair can remineralize up to 200 micrometers in depth. It reduces the caries activity, which the fluoride does in a much fewer amount of cases. The icon is an infiltration technique where the superior layer of enamel is etched away and the resin is infiltrated in the defect. The handling, it's a bit more invasive, of course, compared to the curodont repair, and the handling can be a little bit cumbersome, especially if you need to treat areas interproximal. The GC Tooth Mousse Plus is a casein phosphopeptide calcium phosphate fluoride, which is recommended to be used for sensitive teeth. And then the Remin Pro is also a fluoride enhanced hydroxyapatite gel, which is used on sensitive teeth or beginning demineralization. But all of those products cannot remineralize the tooth in depth. As an inspiration, I have been quoting those investigators who participated in some of the studies, which summarize that the guided enamel regeneration with curodont repair and fluoride is simple, safe, and effective. It is non-invasive and very suitable for early caries lesions. It is superior to the present clinical gold standard of fluoride treatment alone. This is what we have seen in all the studies. Curodont repair offers an opportunity at a threshold between preventive and restorative interventions. So time is on our side. We can remineralize incipient tooth decay and avoid doing drilling and filling. With that, I thank you very much for your attention. I hope you got some inspiration. And please reach out to us if you have any questions. And thank you very much for your time and for your attention.